today I will be showing to you the procedure for washing patient's hair in bed. The condition of their hair and how it is styled is an important part of patient's identity and well-being. So assisting them with hair care is a fundamental aspect for nursing care. Hair care is an essential part of personal hygiene and has an important role in maintaining self-esteem and quality of life. Supporting patients in maintaining hair care when they cannot do this themselves is fundamental aspect. The first thing that we need to do, using the appropriate equipment. Patients who are confined in bed will unable to wash their own hair. This can have a negative effect on their well-being. However, it is possible to maintain clean hair using dry and no-rinse shampoos or no-rinse shampoo cups. Preferences for hair care products is individual, so patients should be invited to provide their own if they wish. Those with underlying skin problem may have therapeutic shampoo, which may need to be prescribed, or allergies for some of the ingredients found in washing and cosmetic products. Information about the allergy should be recorded in the patient's record. Before attempting to wash the patient's hair with water and shampoo, it is important to check there are no contradiction or precautions such as spinal or neck injuries. You should be also assessing how quickly the patient becomes tired. For example, it may be appropriate to plan hair washing at a different time to bed bathing. These are the things that we need to remember. First, keep the patient warm at a time. Position a linen skid near the patient. This is to ensure you dispose of used linen immediately to minimize the dispersal of microorganisms and dead skin scale into the environment. Check the scalp and surrounding skin for pressure damage and underlying skin condition. Avoid contaminating dressings and drains of water. Gently pat the hair and surrounding dry skin to reduce the risk of friction and damage and discomfort for the patient. Use the correct manual handling procedure and equipment to avoid injury to yourself and to the patient. If the patient is unconscious, remember to talk to them through what you are doing and avoid talking to colleagues over the patient. Here are the procedures that we need to follow in doing shampooing. Review the patient's care plan for hygiene and check if there are no contradictions in positioning the patients in flat bed. Ensure someone will be available to help you in positioning the patient during the procedure if required. Discuss the procedure with the patient, ask about their usual hair routine, and gain their information consent for the procedure. Check whether the patient has any pain. Administer analgesia if necessary and ensure it has been taken effect before starting the procedure. To help relieve any pain associated with the moving the patient, ensure the patient's privacy and check the environment is warm and free of draughts. Check whether the patient need to empty their bowel bladder before the procedure. Assemble your equipment and ensure that everything is to hand to minimize the amount of time the patient is lying flat. Ensure the bed is at the correct work height Decontaminate your hand and put on the apron to reduce the risk of infection. Remove the patient's clothes from their upper body and cover with a sheet to maintain dignity. So assuming that the patient already removed their upper cloth, so we will cover it with a towel to maintain their dignity. Next, we will remove the pillow from the behind of the patient's head so that they are lying flat. This allows the water to drain away from the eyes and ears during the procedure. Ask the patient to let you know if they feel uncomfortable in this position at any time. So once the patient is already lying flat, remove the head of the bed so that you can access the patient's hair easily if there is. Place a plastic sheet under the patient's head and shoulder and wrap the towel around their shoulder. Assuming this is the plastic, we will put behind the patient's head. And then we will wrap the towel on our patient's shoulder. Position the patient's head on the shampoo tray, ensuring the following manufacturer's instruction carefully. A towel can be placed under the neck for support. Following manufacturing instruction, ensure that the receptacle that will conduct the water from the shampoo tray is positioned under the drainage spot. Fill the disposable bowl with warm water and allow the patient to check for the temperature. So we need to make sure that the water that we have on our basin is not too cold and not too hot. But we can ask the assistance from our patient to check if the temperature is already okay with them. If required, cover the patient's eye with a disposable washcloth to protect them from the water and the shampoo. Let's assume that this is the disposable jug. We will put it behind the patient's head and make sure that the hair is already on the jug. Next, we need to take the water from the disposable bowl and wet the patient's hair. Start at the front hairline and allow the water to drain down and away from the face, avoiding the eyes and the ears. So we are doing like this. We start from the hairline and we will let the water run away. Apply shampoo and massage it through the hair. Check regularly if the patient is comfortable and can maintain their position. So now we can apply shampoo and conditioner on patient's hair. Check regularly if the patient is comfortable and can maintain the position. Using the jug, it's time to rinse the patient's hair with water. Pat the hair with towel. This is to remove the excess water. We will remove the equipment used. And we will wrap the hair with towel to dry it. We will also remove the plastic that was placed earlier and discard. This dispose of soiled bed linen directly into the linen skip. Replace the bed head and reposition the patient so they are comfortable. Help the patient get dressed. Style the patient hair according to their preference. If possible, try to make the social situation. Offer them a drink and a mirror so they can see and advise you about the style and participate in their care. Finish the bed and Finish the bed and ensure the patient is warm and comfortable with a cold bed, a drink, and their belonging within their reach. Dispose the equipment according to the local policy. Decontaminate the shampoo tray and drainage receptacle according to the local policy. Lastly, we need to record the care that has been given, record and report any abdominal findings, and update the patient's care plan if required.